would like to welcome everyone to discussion 7 of our GeauxConsumerLA Health Initiative. This session is about libraries connecting consumers to services. And so today we'll be featuring two libraries that have different approaches to how they handle consumer health services. Wow, I'm doing really well this morning. So, some basics first of all. This is a international educational program that provides free, short, on-demand consumer health training for the librarian, information professional, or staff with an interest. By doing the classes on the GeauxConsumer website, one of which must be beyond an apple a day, you can achieve a level 1 or level 2, depending on how many you do, MLA Consumer Health Information Specialization. You'll accumulate enough hours. You can then go ahead and apply for that. It's $75 if you're a non-MLA member. It's $55 if you're an MLA member. If you happen to live in the South Central region, which is Arkansas, Louisiana, New Mexico, Oklahoma, or Texas, you can apply for a waiver if you have taken the classes through here, or most of them through here, and we will pay for you to get your certification, your specialization. Every video is posted in its unedited format, and then it will be transcribed and reposted to meet 508 standards. The credit for the discussions may only be obtained after you've done the reading that was required and you've watched this video. So make sure that you've done the reading prior to going to the evaluation form. And that is our project website. It has everything that you want to know right there. And I would like to thank the National Network Library of Medicine, specifically the University of North Texas Health Sciences Center, from which we obtained the grant to provide these services. And so today I am very excited to have two speakers. The first speaker is Kelsey Grabeel. She is the Assistant Director of Health Information Center at the Preston Medical Library at the University of Tennessee Medical Center in Knoxville, Tennessee. And she gave me her bio, and I realized that I closed my email, so I cannot get to it, which was not very smart. So I'll just let her give you a few extra words, if she'd like, about her background, and then I'm going to turn it over to her. I'm going to actually stop sharing my screen and then turn it over to her now. And okay, Kelsey, you are now the presenter.
Okay. Hi, everyone. My name is Kelsey Grabeel. I'm the Assistant Director of the Health Information Center. My area that I work most in is with health literacy, patient education, and I'm specifically interested in rewriting patient education to make it easier to read. So to begin, I'll start with what is the Health Information Center. We are 1,600 square feet of space that is dedicated to patients, their family members, and the community. We are connected to Preston Medical Library, which is the library for our residents, nurses, and staff, and we have a reference desk that sits in the middle that connects the two. But the Health Information Center, we have books, comfortable seating, and we also have computers. We are run by faculty librarians and staff, the same faculty librarians and staff that run Preston Medical Library. And all of our faculty librarians and staff specialize in the Medical Libraries Association's Consumer Health Information Specialization. In our Health Information Center, we have a book collection. We wrote a collection policy specifically for our AHIP books, and those outline the selection of books as well as our weeding protocol. When we pick books, we focus on the top 10 diseases in Tennessee, And before we even began, we contacted the medical centers of excellence for their recommendations. We have 6 centers of excellence at the medical center, and those are brain and spine, cancer, advanced orthopedics, women and infants, heart, lung, vascular, and then emergency and trauma. We do have a book budget, so we are able to update the books throughout the year. It's especially useful because we get a lot of recommendations from physicians as well as the public. The public can check out our books by becoming a member of the Health Information Center. So to do that, they fill out a form, and we look at their driver's license, and then we can check out books to them. We opened the health information in October of 2014, so that's when we started keeping track of our, when the book started being able to be checked out. So from October to December of 2017, we have 405 members, and during that same time, we have had over 1,000 books checked out. So right now, we are averaging about 43 books per month. Most of the books are returned. I think we've only had about 10 in the 3 years that we've been open that have not been returned. Along with the AHIP book collection, we also offer a health information service. We have been doing the health information service long before we opened the Health Information Center. But we provide health information for patients, family members, and the community. They can call us. They can easily walk in since we are located on the first floor of the medical center, kind of what we like to call Main Street. And they can also fill out a web form or email us if they would like their information that way. We are averaging about 1,000 searches a year, or about 85 each month. We do provide them with easy-to-read health information, and we focus on providing from those government resources that we know we can trust. To further expand our health information service, we have been able to partner with the Pat Summit Clinic here at the Medical Center. Here we receive requests from patients and caregivers. So the patients and their caregivers request more health information, and the staff refers them to us, and they recommend the Health Information Center. So then the staff offers to fill out the form for the patient and caregiver, and it's an online form, and it goes directly to us. So then we put together the packet of information. Sometimes we'll do 2 packets, one for the patient and one for the caregiver, and then we send that information to the address that was provided. We also have something called Get Well, which is an in-room television service that provides patients access to videos, and it's also how patients can watch TV. But they can also request health information from the library through their TV. So they go to Get Well and they click on services, and we're under the Health Information Center. And so it asks them if they would like health information, and they click a button and it notifies us. So we then get the patient's information for room number, and we call that room back, and we ask them what kind of information they're looking for. And then we fill the request and bring the information up to the health unit coordinator. The health unit coordinator then delivers it to the nurse, who will deliver it to the patient. So then when we come back down to the library, we document in the patient's chart the information request that we've filled. The nurse will then go on the patient education chart, or patient's chart, and then mark the task complete for comprehension. We only average about 7 per month for these. We have tried different marketing techniques, but we're still around that 7 to 10 per month range. We do work with hospital marketing to market the Health Information Center. So we have signs placed throughout the hospital. There are signs at the lobbies right near the elevators, and we have one really large sign at the entrance of the hospital. We've also received permission to place table tents and brochures throughout the hospital. We have about 37 locations right now where we go monthly, and we refill the locations with our table tents and brochures. We do monthly segments on our local news station, WBIR, where I will talk to the news station about the Health Information Center and our services, and that will air at the 5 o'clock news on that day. We also have a healthy tip series. We write these healthy tips based on our books and health topics of the month, and then that is distributed to hospital marketing, who distributes it outside. To better promote the Health Information Center inside the Health Information Center, we created a HIC engagement task force. So we have monthly displays at the entrance of the HIC. That involves a table, and on that table we have our books, and then we promote different health topics. So we really focus on the health topics of the month, and we try to make a display table out of that. We also host traveling exhibits. We've had Harry Potter's World and Pictures of Nursing, which are from the National Library of Medicine. And then we place a chalkboard right outside the Health Information Center. And that chalkboard's changed every other week, and we promote what we have inside, as well as, again, that monthly health topic. Here's actually a picture of one of our chalkboards that was done in the fall. Due to the marketing that we've been doing inside the Health Information Center, we really feel like it's had an impact. In 2015, we had 212 books that were checked out, and we started this at the end of 2016, and we had only about 306 books checked out. And then in 2017, when we were really full force into this, we had 510 books checked out. So that was a really big jump, and we were excited about that. Our membership has stayed about the same. It's only about a 20% increase each year. 2015, we had 104 members, and then 2016, 125 new members. And then in 2017, 151 new members. So we do have a lot of repeats that come back and continuously check out our books. We work very closely with our Centers of Excellence here at the Medical Center to promote our services and our book collection. I do send the Vice Presidents updated list of our book collection related to their area, and I also send it to the coordinators in their area so that they can also have a copy. We received the permission to put the table tents and brochures in their areas. And then we try to set up meetings with them to discuss our services and how we can promote them and how we can better help their patients. Currently, we're focusing a lot on having health information, patient education booths at their locations. So we're trying to bring the Health Information Center to them. Since we are at a large academic medical center, we can be kind of far from like the Cancer Institute is on the other side of the hospital. So today we set up a booth at the Cancer Institute so that we could alert patients and their family members to our services. And at the Health Information Center, the librarians are leading a health literacy initiative for the medical center. In 2015, we had a health literacy forum, and we had about 100 participants. We hosted it here at the medical center. And then we also did a health literacy pilot project in which we surveyed the medical center to get their knowledge on health literacy. We had about 196 respondents. We targeted nurses and pharmacists and medical center staff. And then with that, we then went to nursing huddles and their unit council meetings, and we talked to over 200 nurses about health literacy. We also did a institution-wide health literacy assessment, and we used the health literacy environment of hospitals and health centers. And we looked at navigation, print communication, oral communication, technology and policies and protocols, and how we were doing in those areas related to health literacy. And then based on those findings, we hosted a Health Literacy Wisdom Summit, and we had two keynote speakers, Dr. Cynthia Bauer and Dr. Rima Rudd. And Dr. Rima Rudd is the one that wrote the tool that we used. And then we are still doing an ongoing health literacy initiative here at the medical center. And that's all. Are there any questions?
Kelsey, what was the name of the tool that you used again for the assessing?
We use the health literacy environment of hospitals and health centers.
Health literacy environment?
Health literacy environment of hospitals and health centers. And it's by Dr. Rudd and Anderson. Was her co-author.
Was it very expensive, or do you not know?
To use the tool?
Yes.
The tool was free online.
Oh, cool. Well, even better.
Yeah.
All right. Does anyone else have any questions? We have about 9 different people on, so. Does anybody have any questions for Kelsey?
Oh, sorry.
That's okay. All right. Well, thank you, Kelsey. I find it very intriguing. It must be really nice to have a growth of like 20% every year to see that.
It is. And just the amount of books that have been checked out now and by repeat patrons, it's just been really encouraging to see that.
Lexi Brackett would like to know, could you tell us more about the summit and who attended and how it was received?
Sure. So we hosted a health literacy summit, wisdom summit, in June of 2017. We had about 50 participants. We had people from all over, actually. We even had someone from Canada. And it was received very well. We did a lot of small group activities since it was a smaller conference. And Dr. Rudd talked about her tool in health literacy and then health literacy in hospitals, and we focused on how we use the tool in the medical center and what we found. It was a day-and-a-half conference, and we had very positive feedback from it.
Is that like an agenda and stuff that you would share?
I'd have to, oh gosh, I'm trying to think of where we had, if I can stop sharing, I can see what I can find.
Well, I mean, I can always post it up on the website after.
Yeah, I'll take a look.
If you can look and if you can find an agenda, because then that people will have a better idea of the types of things that you did and what you call the group activities and things like that.
I will take a look. I know we had it available online, so I just have to make sure that that is still up.
Okay. All right. Does anyone else have any questions? And I want to thank Diane. She found the link to the tool, and I put that in the chat box.
Great.
Does anyone else have any questions? I'm going back to make sure I haven't missed any. All right. I don't see any more questions. So I'll go ahead and thank you, Kelsey, for your presentation. It's very exciting to see a place that has very active inroads within their health institution, their health facility, and their hospital, reaching out to consumers and providing great information. So I really appreciate it.
Thank you.
Sharon.
Thank you.
I'm going to now change David Duggar, who is our next person. And if I get my PowerPoint back up. And it's very awkward how this system works. I haven't figured out how the NNLM people make it look so beautiful. Okay, so David Duggar is the head of Liaison Services. He is professor here. He has achieved the highest you pretty much can achieve as far as his career here, and he is at the Health Sciences Library here at LSU in Shreveport, and he's a great colleague, and I am now going to share, turn everything over to him.
Oh.
And it's coming over to you now, David.
Okay.
There you go.
All right.
You looked good.
I was good there. All right.
Okay, now you're good.
Okay. All right. So I'm here today to talk a little bit about Healthy Links, which is a website put together by the librarians here at LSU Health Shreveport and Shreveport through a grant. So it began back in the year 2000. We received a grant from the National Library of Medicine, and this was specifically to help the public libraries because we were getting questions from them because they were getting questions from their patrons asking about health information, and they wanted to know what should we be telling them, what good sources can we give them for this. So this grant was created to serve the 29 parishes in the north part of Louisiana. There are 64 parishes in Louisiana, so a lot out there. And it was called Healthy Links, and you can see the link right there at the bottom one, www.healthylinks.org. It's a nice, easy thing that people could get to very quickly just by going directly to it. So that you didn't have to go to the library itself to get to this. So our initial criteria for creating it was to make this easy to navigate so that people with low reading abilities and low computer literacy can actually navigate through the system. We wanted to be very selective on our consumer health sites. We wanted to make sure about the stability of these sites and that they were truly authoritative in what they were giving in the information. And then even more important was we wanted to actually limit the number of sites so that you could avoid all of your complexity in trying to navigate through the database and avoid all those hierarchical lists, because I know everyone gets complaints from people that say, I have to click, I have to click, I have to click. And we wanted to make things as less clicking as possible to get to the information that you wanted to get to. We made revisions in 2005, going back and looking at the system, and at that point we actually went through and created a much more selective criteria for Healthy Links. And there's 6 items, and these are the first 2. So first, setting up definitely on authority that the sites have to be reputable, trustworthy, letting people know that these are coming from the federal government and then from professional organizations such as American Academy of Family Physicians. They may be coming from nonprofit organizations as well, or businesses. So Mayo Clinic being considered a very authoritative and professional, trustworthy site to pull items from as well. The other item that we were looking at, and the bottom sentence of that, important that it says information should be produced or reviewed by medical professionals. So not only were we looking to see what it said on those websites, but we also, for a time, actually had physicians in the hospital and the med center that were going back and letting us know some of the information on the sites, whether or not they felt that these were worthwhile based on their profession that we were drawing from. The audience, of course, is everything we were trying to tend for the general public as opposed to medical professionals, to avoid as much jargon as possible so that it's easy to read and comprehend. Our third and fourth criteria was disclosure. The sponsoring organization and the purpose of that site needs to be displayed. You have to be able to know who is actually producing the information. And then unbiased objectivity. These needed to be limited in advertising. So some people will say, oh, you've got WebMD, you have all these other exciting sites that are out there, and we were not wanting things like that because there were too many ads. And we don't, what we want is people to get to the information as easily as possible, to be able to find it easily and not be overwhelmed with all these ads and such on the same screen. The final two criteria is currency. Information should be current, and so again, looking at the bottom of the websites as usual to see when was it last revised, when was it updated, to see how current the information is, and even if the information isn't changing each year, are they looking at it and making sure that this is current information, because some information doesn't change. And then the design itself of our site and of the sites that we were going to go to, but our site specific needs to be clean and attractive so you can easily navigate, and that's what we're looking at. And that the content that people can get to on both our site and when you're getting into it should be free. Some might have a login, but there should not be any fees. And the logins that we found on some things were usually for their tracking purposes, for their way of counting how many people are using this particular product that they have on their site. Okay, so the database actually went into existence in November, and so from November, December of 2000, we were getting 125 hits per month. And through that grant, which was creating the database, there was also funding for training, outreach, going to the different public libraries to let them know we've created the product, here's how you can search it, here's how you can let your patrons know about it, these are some of the resources. And this, we actually got a lot of funding throughout the years, and so July, August of 2002, you can see it had actually increased to 3,000 hits per month on our database, and then by October 2005, 32,000 hits per month, and that was all through these training sessions and through the grants and marketing. Up until 2013, 2014, when we were all one main institution of LSU, and we're still having some funding that we could use for marketing platforms, such as billboards, radio announcements, or newspaper notices, or again paying for us to actually go to the different libraries and present programs. You can see our high point for the that entire fiscal year was 863,963 actual views on the page. Our past year of 2016, 2017, you can see is 90,193 views, which has gone down, but we've now changed to using Google Analytics for the statistics, and we don't have all of that funding to do this predominant advertising and marketing of the database that we used to. And I have to say, billboards was something that at one point NLM allowed, and I'm probably sure that they regretted it after a while because of the costs and all, but it was definitely a very easy way for people to see it throughout the different cities as they were driving through and the placement of it. The other marketing points for the database were our listing on the library's main page and on the institution's main page. And that had been a very predominant image that said Healthy Links actually in the center of the institution's main page to get to. So that has now decreased to just a very small icon on their listing to get to. So that's another point. Within the hospital that we serve, University Health now, there is Epic, which we use, and so there was a link to Healthy Links within Epic. And we actually also did brochures, which were in the hospital and in the various clinics, women's and children's clinics, ambulatory care clinic, eye clinic, and all. And those brochures also go out to the public libraries, and I still find them, as the circulation does in different public library branches in Bossier and for Bossier Parish, for Bossier City, which is part of our Shreveport-Bossier metropolis area, and in the Shreve Memorial Library System, which is the Shreveport system covering the parish of Cabot. Okay, so this is what Healthy Links actually looks like, or at least the top part of the page. And you can see up at the very top right hand where it says Home, About Us, and Contact Us. Under About Us is where we actually have a little info about what the criteria for Healthy Links is, with a link to those 6 points right there that people can get to. The blue bar going across, it says diseases and conditions, medicines, procedures, and surgical operations are all things that were put in by the librarians going through the different databases like the Mayo Clinic, Medline Plus, American Academy of Family Physicians, Kids Health, and actually pulling different items regarding those particular diseases and conditions and such. Lab Tests is an actual database, Lab Tests Online, which we are able to get to for free and publicize. The picture you can see now in the redesign of the Happy Family, this changes, so there are many different family photos, seniors, African Americans, Hispanic, as it goes through to make sure that everyone in the community knows about Healthy Links and that it is geared for everyone for them to go to and see. You can see health news and featured links, and that changes again. Sometimes it's a monthly item under the featured links. Under health news, the current bit is the CDC with the holiday stress and all, because even though the winter holidays of Christmas and such that have ended, in Louisiana we still have the whole Mardi Gras season, which can be very stressful for all those people involved that way. On the left-hand side, you can see the beginning links of several of our different pieces, and I'm going to go to the full list of that right here. So we actually have the dictionaries, which used to be one of the big tabs going along the very top. So that's the link to the different medical dictionaries. The major health sites include Medline Plus, the CDC, Mayo Clinic, American Academy of Family Physicians, and Kids Health, all as some of the major health sites that people could go to directly. We do have a healthcare reform link as well that was created based on the needs that people needed a few years ago, so that has been added. Then some of the other key items originally that we had on the left-hand side to focus on were to be a smart patient, the clinical trials, end-of-life issues, finding health care, and staying healthy. And these give links not only to specific NIH or NCI clinical trials, but information on why you want to be in a clinical trial or what you should be thinking about for a clinical trial. On the finding healthcare information about Medicaid and Medicare, CHIP, for us it's LA-CHIP for Louisiana, CHIP for Child Health Insurance Program. Staying Healthy has information on wellness, nutrition, exercise, questions you should ask your doctor on being a smart patient, and then links even to how to find different physicians if you wanted to look up and find out who that particular person was. The next group is environmental health, for kids, teen health, the mental health, senior health, women's health, and teacher education. And all of these were created through different programs and expanded on through different grants and outreach to the community needs. Mental health has a lot and was one of the more recent ones, and teacher education is the most recent one that we have there. Before I go to the next slide, you can see at the very bottom, we do have a link that is for Spanish, and several of the major health sites are available in Spanish. So this gives a link to those Spanish versions as well. So that was another thing we wanted to have available there. So this just gives you a look at what happens when people click on the teaching part. Again, that was the teacher education down at the bottom there, taking you to this page, and this was formed this past year as our grant for teaching science for gamification. And you can see that we're covering some very basics on the layout here. We just have a quick preface about what gamification is, learn more about gamification, giving different books and other materials, some different websites where they can communicate and find out information that way. And then we've broken down into the 3 different school groups, elementary, middle, and high school, different games that we have pulled from the National Library of Medicine. And these are scattered throughout all the different areas within the National Library of Medicine, whether they're in environment, if they're in biology, if they're in disaster, you know, all the different types to try to pull together, and that was vetted as a project there. We have the manual of everything in one spot, and then we have bookmarks to help promote them as well, which people can pull up and print out as PDF files in color as well. And then, of course, always disclaimers, very important at the very end, at the fact that we are just providing the links to the information. We are not making recommendations that you need to do this because we are not doctors, we are librarians. But we are providing information that we feel that people can get to, that is going to be worthwhile, easy to read, understand, and help direct them as they're going along. This screen just shows, again, usage statistics, and from this, the grant that we had finished last year, it took us the year to actually create the website, and then it went live in May, and you can see that over the summer, it was kind of low in use at that point, but it started picking up again as school was starting up, because this was specific for the teachers to let them know about it. And it's done very well. They've sent us photos of kids using it and accessing it through their tablets and iPads as well that they have in their schools. Okay. Do you have any questions? Let me send this back.
I just wanted to let people know that we have done quite a few grants and created specialized links, as David said, and they have gone, it's been very nice to have a place to put the information that we've gathered from there in specific spots. So it's very nice. And David, are you still sharing?
Did it, oh, I think it stopped it so I could actually see, but I can go back.
No, I think you stopped sharing.
Okay.
Or maybe you have, I don't know. So does anybody have any questions? Diane has thanked us for highlighting that resource. She's going to add it to lesson plans for middle and high schoolers. And there are zombie health instruction. I want to hear about the zombie health instruction. Maybe we should have Diane talk about that someday. I'm going to write that down. I think that sounds cool. So does anybody else have any questions? The goal with this is to show that you don't necessarily have to have a physical library that people come into to reach out to your community, especially if you have something like LibGuides or something like that, or if you have someone who does maintain your website and you want to create small pages that highlight things that you're specifically doing, then that's something that can actually really attract a lot of attention to your website and such. So I just wanted to have you all understand that there are multiple different ways of being able to reach your consumers. And we all wish we had what Kelsey had and David had, both things, obviously, because that would be the ideal. But this gives you a couple of different approaches. So does anybody else have any questions? All right. Well, I just want to do a real quick before I give you the link to share my screen again. So I just want to tell you about the next speaker because, and hopefully this will actually happen, because of the government shutdown and then all of the storms, our speaker changed from someone who was higher up in the Department of Health and Human Services to someone who's worked on many projects with her. And so it's going to be Courtney Schrock. She's Health Communication at eHealth Arise Fellow, and she's at the Office of Disease Prevention and Health Promotion at the U.S. Department of Health and Human Services. And she's going to talk about the article that's posted on the website about how you identify quality consumer health resources and what they found. And then also there's a link that's bonus, you don't have to necessarily read it, of how you should actually write web materials. And so both of those are on our website. You can register at either of these links, which I'm going to put into the chat box. If I can get my thing to work. And I'm going to put those into the chat box right now. If you'd like to register, as usual, you won't have to register in order to and to participate. You can always just get online right before it starts, and the password is always on the website as well. So now I will paste in the link for the evaluation, and I want to thank everyone for their time and attention, and I look forward to hopefully seeing you all on February 16th. Please note that this is a different day. We normally have been meeting or having these sessions on Wednesdays. Because of the scheduling, it's now Friday, February 16th. And hopefully we won't have another government shutdown that'll mess everything up. I hope. So once again, February 16th from noon to 1 p.m. And here's the evaluation URLs in the chat box. And I appreciate all of you participating. If anyone has questions later, you can always contact me at the email on the website. Thanks again.